Hi, and welcome to our channel. Before we start, I kindly ask you to give us a like and subscribe to our channel. It doesn't cost you anything, but it's a great help for the channel to be considered well by YouTube. Thanks for the attention. Have you ever had a wart and wondered how to get rid of it? Today, we delve into the world of warts on hands and feet, exploring how to recognize them, strategies to prevent their spread, and effective treatment options. Warts might seem like a minor inconvenience, but armed with the right knowledge, you can manage them effectively. So whether you're dealing with this common skin condition or simply interested in understanding it better, this comprehensive guide has you covered. Stay tuned to learn more about this common skin condition. So, what exactly does a wart look like? This is a question many people ask, and rightly so. Recognizing a wart is the first step towards its effective management. Warts can appear on both hands and feet, and their appearance can vary significantly. However, there are some common characteristics that can help you identify them. Think of a wart as a small, rough growth on the skin. They are typically raised and can be either smooth or rough to the touch. Some warts may resemble a small cauliflower, while others might look like a solid blister. Their size can vary from less than a millimeter to several millimeters in diameter, and they can occur individually or in clusters. The color of warts can also vary. They can be the same color as your skin or slightly darker. Some warts may even appear grayish in color. It's also not uncommon for warts to contain tiny black pinpoint spots. These spots are not a cause for alarm. They are merely clotted blood vessels. Warts on the feet, also known as plantar warts, often develop on the pressure points of the foot, such as the heel or ball. They may feel like a stone in your shoe. Unlike other warts, plantar warts are often flat or grow inward due to the pressure of walking and standing. Mosaic warts are another type to look out for. They are a cluster of several small warts growing closely together, and they can occur on both the hands and feet. It's also important to note that while warts are usually painless, they can sometimes cause discomfort, especially if they are on a part of your hand or foot that you use frequently. Remember, recognizing a wart is the first step to treating it. If you're unsure whether a growth is a wart or something else, it's always best to consult a healthcare professional. They can provide a definitive diagnosis and guide you on the next steps for treatment. Ever wondered what causes warts and how you can prevent them? You see, warts are caused by the human papillomavirus, or HPV, one of the most common viruses that can affect the skin. There are over 100 different types of HPV, but only a handful lead to the growth we commonly refer to as warts. The virus invades the skin through small cuts or abrasions and causes rapid growth of cells on the outer layer of the skin, resulting in a wart. This is why warts often appear on areas of the skin that have been broken or damaged. HPV strains causing warts on hands and feet are typically non-cancerous and are different from the strains associated with other health issues like cervical or oral cancer. However, they can still be bothersome and in some cases, painful. So how does this virus spread? Well, HPV is highly contagious and can spread through direct skin-to-skin contact with an infected individual. You can also get the virus indirectly by touching a surface or object that an infected person has touched, such as a towel, a doorknob, or the floor of a public shower. Now that we know what causes warts, let's talk about prevention. Preventing warts essentially involves avoiding exposure to HPV. This can be achieved by maintaining good personal hygiene. Regularly washing your hands and feet can help to keep the virus at bay. Another preventive measure is to avoid walking barefoot in public places, especially in moist environments like swimming pools, locker rooms, or communal showers. These places are often breeding grounds for HPV and other types of fungi and bacteria. Wearing flip-flops or waterproof sandals can protect your feet from coming into contact with the virus. Sharing personal items is a big no. Try not to share towels, socks, shoes, or any other personal items with others, especially if they have warts. Remember, HPV can survive on these surfaces and can easily spread to the next person who uses them. Avoiding direct contact with warts, whether on someone else or even on your own body, is also crucial. If you have a wart, try not to pick at it or scratch it, as this can spread the virus to other parts of your body or to other people. Lastly, maintaining a healthy lifestyle can boost your immune system, which in turn helps your body fight off viruses, including HPV. This includes eating a balanced diet, exercising regularly, and getting enough sleep. As the old saying goes, prevention is better than cure. And this is especially true when it comes to warts. By understanding what causes warts and taking these preventive measures, you can significantly reduce your chances of getting this common skin condition. So there you have it, the ins and outs of what causes warts and how you can prevent them. Stay tuned for the next section where we'll dive into the various treatments and care options available for warts. Until then, remember, knowledge is power, and in this case, it's the power to prevent warts. Got a wart? Don't worry, there are several treatments available. Now, let's delve into some of the options that can help you bid farewell to those bothersome warts. First up, we have keratolytic creams and solutions. These products work by gently breaking down the tough skin of the wart, making it easier to remove. They contain ingredients like salicylic acid, which has been used for centuries to treat a variety of skin conditions. It's a relatively slow process, but with consistent use, these creams or solutions can effectively get rid of warts. Now, let's move on to a slightly more aggressive treatment, cryotherapy. This method involves freezing the wart with a very cold substance, usually liquid nitrogen. The freezing process destroys the wart tissue, and after a while, the wart naturally falls off. It's a bit more intense than using creams or solutions, but it's also typically faster, and often done under the supervision of a healthcare professional. If your wart is particularly stubborn, your dermatologist may suggest a minimally invasive surgical intervention. This could involve curettage, where the doctor cuts out the wart, or laser surgery, which uses a strong beam of light to burn and destroy the wart tissue. These methods are usually reserved for warts that haven't responded to other treatments. It's important to note that while over-the-counter treatments can be effective, they should be used with caution. Some of these treatments can damage the surrounding skin if not used properly. Therefore, it's always advisable to consult a dermatologist before starting any treatment. They can guide you on the most suitable treatment for your specific case and ensure you're using it correctly. But let's not forget about natural remedies. While they may not be as fast or as effective as medical treatments, they can provide some relief and may help smaller warts disappear. Some popular home remedies include applying apple cider vinegar, tea tree oil, or even duct tape. However, you should always be careful when using these remedies and stop if you notice any adverse reactions. Lastly, it's important to be patient when treating warts. They can be stubborn, and it may take several weeks or even months for them to fully disappear, no matter the treatment method. Don't get discouraged if you don't see immediate results. Consistency is key in wart treatment. Remember, the best treatment for your wart depends on your specific case. So if you're dealing with a wart, don't hesitate to reach out to a healthcare professional. They can provide you with the guidance and care you need to effectively manage and treat your wart. Before we conclude, here are some final tips to keep in mind. The battle against warts on hands and feet is ultimately won with prevention. It's essential to maintain exemplary personal hygiene, keeping your hands and feet as clean and dry as possible. And remember, the human papillomavirus, or HPV, responsible for warts, thrives in warm, moist environments. So avoid walking barefoot in public places like pools or gyms, and always wear protective footwear when necessary. Equally crucial is to avoid direct contact with infected individuals or surfaces. Yes, warts can spread, and it's best to be cautious. It's not just about sharing personal items like towels or socks, but also about being mindful of common areas like locker rooms or communal showers. And while home treatments can be effective, don't let stubborn warts linger. If they persist despite your best efforts, don't hesitate to seek medical advice. A dermatologist can provide the most suitable treatment options for your specific case, which may include keratolytic creams or solutions, cryotherapy, or even minimally invasive surgical interventions. Keeping these strategies in mind can help you not only treat existing warts, but also prevent future ones from appearing. With these tips, you can keep your hands and feet wart-free. That's a wrap on our comprehensive guide on warts on hands and feet. We've journeyed through the landscape of wart recognition, understanding their causes, and the importance of prevention. We've highlighted that these pesky skin growths are due to the human papillomavirus and can be prevented through maintaining good personal hygiene and avoiding direct contact with infected skin or surfaces. Our exploration of treatments revealed the effectiveness of keratolytic creams, freezing techniques, and even surgical interventions. However, always remember that professional advice from a dermatologist is paramount to determining the best course of action. Lastly, we emphasized that prevention is the best cure. Keep your hands and feet clean, avoid contact with infected individuals or surfaces, and always consult a medical professional if in doubt. Remember, sharing is caring. Pass on this knowledge to those who might benefit. Thank you for watching. Until next time, stay healthy and wart-free.